Coronavirus cases rising in the United States and multiple other countries in Europe. Many experts expected the virus to surge again when the weather cooled down, but the death rate remains much lower. Still, the increase in the number of cases is putting a strain on hospitals, with some not having enough space or staff to handle the new patients. With us now to talk more about what we can expect in the days ahead is medical reporter Lori Johnson. So the number of cases climbing we're seeing, is it because of testing like the president says, or are there other factors?
Well, it's actually multi-pronged, Ephraim. Testing is a huge factor. Can you believe the United States tests over 1 million people per day? That's far and away above any other country, including countries that have much larger populations than the United States, like India, for example. So obviously, when you test that many people, so many people are going to test positive, and so many of these people are asymptomatic. We saw this with Barron Trump and some of the other people associated with President Trump. But there is another factor as well that contributes to these high number of new cases, and that's what we call pandemic fatigue. Remember, people have been doing these mitigation efforts since February and March, and they're tired of it. And now that people are thinking about the holidays and they just want to get out, they're fine. They think maybe I won't get it. You know, the death rate is low, so I'm not going to wear the mask. More people are venturing out. And we see that the kids are back to school, the college students are back to school, young people are getting out again. So there are a lot of different things involved.
What can we expect this winter, you think?
Well, unfortunately, some of the more reliable models are predicting 300,000 deaths by February. We're at about 225,000 right now. So we're talking about 75,000 new deaths. So it's very concerning, especially as we enter into the holidays. Like I was talking before about people having coronavirus fatigue as we get close to Thanksgiving and Christmas. These are sacred holidays, and parents can't believe and can't imagine being separated from their children and grandchildren, getting together in a small room. It's going to be very difficult to gather around a Thanksgiving table wearing masks, or gather around the Christmas tree and keeping socially distant. And so we see that this is potentially a very dangerous period as we all head indoors and get together for the holidays and the rest of the winter.
The numbers can get confusing for people. What about the death rate? Has it gone down since earlier this year?
It's plummeted. Not only has it gone down, it's gone down remarkably. And it's so funny because you really don't hear about this very much in the media because it's very encouraging news. We see that the cases are rising, but the death rate, the percentage of people who test positive who actually die from the coronavirus, is going down. A couple of new studies show that people who are hospitalized for the coronavirus, the death rate has really gone down from 25% down to 7%. These are people who are hospitalized for coronavirus. And so that's 18 percentage points. That's wonderful news. And largely this is because of that doctors know how to treat the disease better.
The White House Chief of Staff Mark Meadows says the administration is focusing on treatments. How soon can we reasonably expect a vaccine and other treatments like therapeutics that the president is often talking about?
Well, the president took these wonderful therapeutics. He took 3 main drugs that attacked 3 different ways the virus kills people, frankly. And the first one, he took the polyclonal antibody made by Regeneron. That is something that sort of activates the immune system. The other drug he took was an antiviral, which keeps the virus from replicating. That's the remdesivir that we hear so much about. And then the third drug he took, dexamethasone, is a steroid which kind of tamps down that cytokine storm that when the immune system overreacts and causes a fatal reaction so many times. 2 out of those 3 drugs are available to the public right now. The polyclonal antibody should receive emergency use authorization within the next few months, but convalescent plasma is very similar to it, and that's available right now to people. Regarding the vaccine, it looks like Pfizer might petition the FDA for emergency use authorization in the 3rd week of November. That is the hint. So it looks like we may have 1 or 2 vaccines by the end of this year or in early January.
Before we let you go, what do you have coming ahead this evening on Healthy Living?
A really great show. I encourage everyone to watch it. I interviewed Christian author Ginny Brandt, and she's a cancer survivor, and she just wrote the book, Unleash Your God-Given Healing. A lot of really interesting information about how to keep yourself well, not just for to prevent or help cure cancer, but for COVID-19 and all other diseases as well.
Very important. Thank you so much. I want to remind you at home that you can catch Healthy Living with Lori Johnson tonight at 9:30 Eastern, and you can find that on the CBN News Channel.